Good morning. Welcome. This is our Saturday morning yoga therapy session through Sattvic Space Yoga Healing Studio, where I teach every Saturday morning. Today's topic is yoga therapy as a lifestyle medicine. Now, what yoga therapy has to do with a lifestyle? As all of you know, yoga, the word says union of your body, mind, and spirit. It's a philosophy called Yoga Sutra of Patanjali, 196 sutras or small aphorisms, 493 are fighting your mind. Manasthir. Practice is called Patanjali Ashtanga Yoga, 8 limbs of yoga. And the outcome of the practice is a self-realization, but it also has a relaxation response and activation of parasympathetic tone. It also switches very rapidly from sympathetic to parasympathetic tone. It increases your baroreceptor sensitivity, reduces your chemoreceptor sensitivity, and it has a lot of other effects like the healing power, has attributes of antioxidant, controls apoptosis, telomere length. What is disorders? The lifestyle we have now, the comfort in our life brings a fear of unknown. What is fear of unknown? Coronavirus. I'm taking all the precautions. Am I safe? Am I going to have a COVID-19? I'm sending my kids to school, whether there will be a mass shooting. This fear of unknown is called stress. And the outcome of stress is a hormone called cortisol. And we know the pathway. The pathway today is called limbic system, which is emotional brain. There are 2 nuclei called amygdala and hippocampus. Amygdala is for fear, hippocampus is for memory. It sends a signal to your hypothalamus. Hypothalamus sends a signal to your pituitary gland, and through pituitary adrenal axis, we have a syndrome. And the pathway is called psychoneuroendocrinology, psychoneuroimmunology, and a relaxation response and parasympathetic activation literally it quiets down this phenomena. So the cortisol, which is the outcome of your stress, first creates a omental fat. It basically uses the extra carbohydrate or sugar we have, converts into fat, which is inside our abdomen, called omental fat. This is for our called thrifty gene hypothesis. That means body is trying to preserve for our future. This omental fat is like an endocrine organ. It secretes adiponectin, pro-inflammatory molecules, and creates a state of inflammation. Inflammation then creates a diabetes, hypertension, atherosclerotic heart disease, what is called a coronary artery disease, and dyslipidemia, which is a high cholesterol and also a high triglyceride and a low HDL. So the whole phenomena today is called a metabolic syndrome. Before we used to say this is a risk factor for heart disease, risk factor for diabetes. Today they're not risk factors. They're all together into one syndrome called metabolic syndrome. Today I have a truncal obesity, tomorrow I'll have a heart disease. Today I have a heart disease, tomorrow I'll have a diabetes. Today I have a diabetes, tomorrow I'll have a hypertension. And most of the people for protection are placed on 4 medications. We call it aspirin, statin, beta blocker, and ACE inhibitor. And I will show you how a practice of yoga has the same effect of this medication. How the effect of yoga has the same effect of aspirin, statin, beta blocker, and ACE inhibitor. And we'll go slowly one step at a time. The relaxation response comes from activation of the vagal tone, or activation of the branches of the vagus nerve, and then also comes from a physical poses called asanas, which is called a sthiram sukham asanam. Stillness, happiness, and your grounding poses. Let's start with our practice, and during the practice we'll be explaining to you more and more how the yoga therapy acts as a lifestyle medicine. Even today, if you look at the whole COVID-19, the first effect, it affects your lung. So you will see the yoga practice improves your function of the lung. And in yoga practice, lung is connected to your heart. Heart and lung is the same organ. When the heart properly functioning, brain properly functions, all the cellular tissue functions, it's improving the lung function. It also quiets down your mind. Manasthir. Biggest impact we have today is the fear, panic, and anxiety. So let's start the first activation of your vagal tone or relaxation comes from secretion of nitric oxide. So when you breathe through your nostril, remember in yoga practice, we always breathe through our nose. We do not breathe through our mouth. Because when you breathe through your nose, the air goes through your nose, the air gets filtered, then our nose is like a individual air conditioner. If outside air is warm, it will cool it down. If outside air is cool, it will warm it up. Then when it passes on the side called a turbinate, it stimulates the mucous membrane of the sinuses. The mucous membrane of the sinuses secretes nitric oxide. Nitric oxide is a potent vasodilator. It opens up the blood vessel, and it also causes endothelial relaxation. Today we know for our health from Western standpoint is based on called endothelial function. When endothelium is functioning well, and we have a health. In yoga, the health is defined as a balance of your body, mind, and spirit. So we'll do the balancing poses. In yoga, health is also defined as a strong digestion, easy elimination, good night's sleep. We have a few asanas for increasing your Jataragni, the digestive fire. We have asanas for proper elimination. We have asanas to proper sleep. We'll practice all of them. So the nasal breathing increases your nitric oxide, and nitric oxide also at the endothelial level increases your acetylcholine and cyclic GMP. And nitric oxide, cyclic GMP, and acetylcholine are the mediator of parasympathetic tone. Like most of you probably know by now, that epinephrine and norepinephrine are mediator of sympathetic tone. So remember these terms, very important. Nitric oxide, cyclic GMP, acetylcholine increases parasympathetic tone. So let's start first with a simple yogic breathing. Yogic breathing will be first exhalation. Lung is like a balloon. It has 6-liter capacity. 4.5 liter is your vital capacity. 1.5 liter is your residual volume. We only breathe 500 cc, 0.5 liter. So you need to learn how to breathe out first. Empty the lung, then breathe in effortlessly through your nostril and breathe out longer than breathing in. Inhalation is sympathetic, exhalation is parasympathetic. So sit down in a comfortable posture and keep your spine straight. If you cannot sit in the ground, sit down in a chair. But in a chair also, you sit down with your spine straight. Merudanda Achal, then called Manasthir. Straight spine, relaxation of the spine, and quieting down your mind. Use your hand. Hand mudras, hand gestures are very important. We have gone through a mudras and acupressure in our last session. But if you touch your index finger and a thumb, this is called Nano Mudra or Nano Mudra. This quiets down your mind. So put it gently over your knees. If you can sit down, this is called the Sukhasana. Take both the feet underneath your knees. Keep your spine straight. Touch your index finger and thumb. Slowly put it over your knees. 5 senses, our vision, hearing, smell, taste, and touch, keeps us awake, alert. That is our mind. There's a consciousness. Most powerful is your vision. Eye is extension of your brain. So close your eyes. Through your nose, first breathe out first, effortlessly. Now we will take a breath in and we'll slowly keep on increasing. If you can do it with us, please keep on doing with us. If not, wherever you feel completely effortless, stay there and breathe. So let's start with a count of 2 in and count of 4 out. 1 and 2 in. Count of 4 out. Count of 4 in and count of 8 out. Count of 5 in, count of 10 out. Count of 6 in, count of 12 out. Count of 7 in, count of 14 out. It increases your parasympathetic tone. The way you know, look at me, I have a saliva in my mouth now. When you have a saliva in your mouth, that means you have a parasympathetic activation. Parasympathetic is called calm and digest. Whole the digestive function is parasympathetic. So the secretion of the parotid gland causes a wet mouth. I didn't drink any water, but mouth is very wet. When you have a sympathetic overdrive, when you're fearful, you get a dry mouth. Another very nice way of relaxation practice is pumping and cupping. Bring both the hands together. Keep rubbing your hands. Keep rubbing your hands. Keep rubbing. When you feel the warmth in your hand, if you're wearing glasses, you remove your glasses. Then take the hands like a cup. Put it over your eyes. And let the eyes take all the heat from your hand. Then you massage your forehead, massage your eyes, massage your face, massage your head and neck. Very, very powerful relaxation. Now, when you're able to sit down like this, you need to create a balance. Remember, health is defined as a balance of your body, mind, and spirit. So, what you need to do, if you have sat down like this, now change your feet. See if you can sit down the opposite way. You'll feel one side is easier than the other side, because you're lateralized. I'm right-handed, right-footed. I'm easier on one side. But try to stay longer on the side you are uncomfortable. Okay. Next, you activate your vagus nerve through a massage of your ear. This is called auricular branch of the vagus nerve. The vagus nerve has a branch which supplies a tragus. Tragus is this cartilage in front of your ear. It supplies your auricle and supplies the external auditory canal. So when you slowly massage your tragus, massage your auricle, also massage in the back, it supplies in the back. Gently when you do it, it starts a relaxation response. In fact, the little bit of massaging inside your external auditory canal, it's a very common practice in East, especially Southeast Asian countries, and like a Thai massage. It's called ear picking, and they almost describe it like a erogenous zone. Like it gives you a profound sense of parasympathetic activation. And when you have a little bit of a massage of the external auditory canal, you feel good. So it's a good, feeling good is your parasympathetic activation. Very important. Another thing you can do, you can cross your hand and hold your earlobe. This is called balancing your both sides of the brain. In fact, in yoga technique, this is called a super brain yoga. In a super brain yoga, you hold the earlobe like this. If you are practicing with me, try to hold it. Try to hold both the earlobe, and then when you stand up, you'll see we'll do a sit-ups on holding like this. This used to be like a punishment, especially in India, when a child in school is not doing well or he is not following the commands, they were asked to hold the earlobe like this and do a sit-ups. It brings your balance back. Very, very important practice. So if you're comfortable like that, you can progress. Next progression is called your Siddhasana. Take your heel all the way to the back. You put your one foot on the top. Your knees will drop down. Remember one thing, this is a relaxation. It is not you are trying. Why? You are creating a central relaxation which is counteracting the sympathetic overdrive of your stress, which is creating your lifestyle related disorder. That's why it is called a lifestyle medicine. This is called your Siddhasana, perfect pose. Next you stimulate your pharyngeal and laryngeal sphincter, like the sphincters in the upper part of the pharynx and larynx is supplied by branch of vagus nerve. So if you can constrict those sphincters, you activate the vagus nerve. Vagus nerve is 80% is afferent. Afferent means the signal goes inside the brain, which you call a sensory signal, and 20% is the efferent. Efferent means coming out of the brain or a brain stem, which is a motor function. This is called a Valsalva maneuver, or in yoga is called a Karno Rogantak Pranayama. Karno is the ear, Rogantak means cure, curing the ear with a pranayama. Technique is you breathe out first. In all yogic tradition, you breathe out first. Take a deep breath in, then close your nostril and the mouth and try to do a forced exhalation with closing your larynx and pharynx. And remember, there is a tube which connects from your upper part of your pharynx to your middle ear canal called eustachian tube. The tube opens up. You will feel there's a pressure on your ear. In fact, we do the same thing if we get a blockage of the eustachian tube when a plane is taking off or a plane is coming down. So let's practice a couple of times. Breathe out first. Take a deep breath in. Feels like also you're trying to bear down. Remember, bearing down is all your parasympathetic activation. Another relaxation technique is parts of your body. If you look at a baby, the baby closes a hand like this. If you take the baby will take the hand like this, thumb inside and close. This is called Balo Mushti Mudra. Balo Mushti Mudra means your baby fist, called Adhi Mudra. So you can put your hands in the front. If you're practicing with me, put your hands in the front with your breathing. So breathe out first. Take a deep breath in. Breathe out. You close your hand like a baby fist. And do it with your eyes closed. Very nice. Wrist gets relaxed with the extension. Breathe in, breathe out. Breathe in, breathe out. So the hand gets relaxed. All the pain comes from the tightness, comes from your all sympathetic activation. Let me show you what happens when your wrist gets relaxed. See here, my hand, initially it will be like this, but slowly and slowly, when I get relaxed, it will go all the way down and all the problem on my wrist will go away. Very important practice. Relaxation. Yeah? So, now you see if you can progress. Next asana is called your Ardha Padmasana or a Swastika asana. Put your one foot in the top and you will feel comfortable because you relax. What you're looking for pain. If you get a pain, you have crossed your limit. Remember, this is the individual practice. You are not competing with anybody. So if you get a pain, what you need to do, you need to back off a little bit. If it still has a pain, you can even go to the ground, but start somewhere. So for me, I'm very comfortable here. I'm staying here. Okay. Next is called a Bhramri Pranayama, or a bumblebee breathing. Like our brain has a frequency, and you create a frequency. A two frequency interacts, it cancels, it's called a harmonic resonance. Mind quiets down. So the sound of Om, like when you do a sound of Om, it also quiets down your mind. Sound of a bumblebee, it also quiets down your mind. And also you can do the same practice with a relaxation of your neck. It's called Brahma Mudra. Let's first start with so just to one or two Om. Om has a three component. A, U, Ma, A, U, M. Comes from lower part of the lung, middle part of the lung, upper part of the lung. And you will do it longer and longer. Initially 10 seconds is good. 20 seconds, 30 seconds is a long exhalation. Again, touch your index finger and thumb. Let's do about 3 Om chanting to bring the relaxation in our body and mind. So breathe out first. Take a deep breath in. Let's do a few to Bhramri Pranayama, bumblebee breathing. Then we'll do the bumblebee sound with a Brahma Mudra, neck relaxation. After this relaxation practice, we will be doing the practice for your health. Strong digestion, easy elimination, good night's sleep. And we'll tell you how the effect of aspirin, statin, beta blocker, and ACE inhibitor is being created by the practice of a yoga. So now to the balance. I can go to the opposite foot now. Take my right, it was the left foot, the right foot. I'm putting it up. Ardha Padmasana. So I can go ahead and do the Padmasana right away, but I'm not doing it. I'm showing it in stages. But to look for pain, there should be no pain. Sthiram Sukham Asanam. An effortless breathing is called Annamaya Kosha to Pranamaya Kosha. Any imbalance you create in the physical body, it shows up in your breath. In a Bhramri Pranayama, you shut down your 5 senses, then you create a vibration. So you have done all with me before. Let's do it all together. Put your index finger in the forehead. Use your 3 fingers to close your eyes. Use your thumb to close your ears. Close your mouth, so you literally shut down your vision, your hearing, smell, and taste. Breathe out first. Take a deep breath in. Do again one more time, pumping and cupping. This is your whole day practice, pumping and cupping. Wonderful relaxation to overcome the sympathetic overdrive of our present day lifestyle. Wearing glasses, remove your glasses, put your hand over your eyes like a cup. Let the eyes take all the heat from your hand. Massage your forehead, massage your eyes, massage your face and head and neck. Let's do the neck relaxation. In neck relaxation, we have four steps. We call it a Brahma Mudra. It's a gesture of your Supreme Being. We have four sides, east, west, north, south. Brahma also have four heads. So relaxation, use your hand, use your Adhi Mudra. Adhi Mudra also opens your upper part of the lung. Thumb inside and close and gently put it over your knees. Now, I'm also very relaxed. What I can do, I can go ahead, put my other foot on the top, and I can sit down in a lotus pose. This is called your lotus pose, Padmasana. See, I went in step by step. It's a powerful relaxation response. That's what you need to create. You know, it's not that, oh my God, how can you sit down like this? No, this will come to you. Prepare your body and mind, so-called difficult asana. There is nothing called difficult asana. All the asanas will come to you. Very important phenomena. So, Adhi Mudra will be breathing out first. Breathe in, put your neck in the back. On the breathing out, we'll have a bumblebee sound. So if you're doing with me, let's start. Breathe out first. Take a deep breath in and put your neck to the back. Notice that's how we also extend your exhalation, make the exhalation longer. And you get a saliva in your mouth. It's a parasympathetic activation. What you look for is a pain. When you bring it down, if you have a pain, you back off a little bit. And also effortless breathing. If you feel your breathing has any effort, back off. Second, turning the head on the side. Breathe out first. Take a deep breath in. Other side. Pure simple science, harmonic resonance Two frequency cancels each other. Body and mind frequency quiets down. And you extend your exhalation, which is parasympathetic. Exhalation is parasympathetic. Third step, breathe out first. Deep breath in. Look all the way to the back without turning your shoulder. Finally, slowly turn your head, drop your head down. Start from the left side, turn to the left, then to the back, to the right. Breathe out first. Take a deep breath in. Opposite side, breathe in. Wonderful relaxation. When the neck is relaxed, your whole body is relaxed. See, the class is called Yoga Therapy, Ayurveda and Western Medicine, a Healthy Convergence. I'm giving you all the Western medical perspective with the Eastern Yogic and Ayurvedic philosophy. And the whole practice is called holistic. It is not reductionist. I'm relaxing my neck. It's not only relaxing my neck. It is actually increasing my neurotransmitters. My dopamine level goes high up. My serotonin level goes high up. My GABA level goes high up. Gamma-aminobutyric acid. GABA is the neurotransmitter needed for sleep. Able to relax your neck, you sleep better. When you relax your neck, your whole body relaxes. Back pain is due to tightness of the muscles in the back. Back pain is not that I have a slip disc, and I have a herniated disc, I have spinal stenosis. That these are all pathology. But the physiology function is the irritation of the nerve, spasm of the muscle, and all the nerve endings are in the ligaments and the muscles. It releases your knee pain, back pain, hip pain. All the pain is due to tightness. When the whole body is relaxed, you can do a powerful called Paschimottanasana, prayer pose to the back. So you can put your hand in the front, it's like a prayer pose in the front. And when you do the prayer pose to the back, let me just turn around so you'll be able to see what I'm talking about. So it's a very important practice. We practice every single day, so you will be able to do it also with me. Put your hand to the back, wherever it comes. If it comes together, put it together. If you can put it as a prayer pose, and slowly you can go high up. And you'll see your spine gets straight, and breathing gets better. You feel a lot better than breathing out. Slowly and slowly it will go high up. This is very important. The lifestyle related disorders, We are seeing today the first group now is the people, the computer people, IT people. They're always hunchback looking at that computer screen. So I tell them, just take your hands off and do a prayer pose to the back, Paschimottanasana. Say, I'm very relaxed, I'm talking, I'm breathing, I'm even singing. It is a wonderful practice. Practice it every single day. Very, very important yogic practice. Again, relaxation comes from the whole body and mind. And you will see when you are properly relaxed, like here, the lotus pose, Padmasana relaxation. You can do Yoga Mudra. Yoga Mudra is a very wonderful relaxation. You hold your hands to the back, keep your spine straight. The way to keep the spine straight, look straight. Breathe out first. Take a deep breath in and slowly come down. See how far you can come down. What you're looking for? Pain. If you have any pain, you back off. But stay where you can stay comfortably. But if you don't have any pain, keep coming down, then look for your breath. If you have any effort in breathing, you back off. But if you can talk, if you can sing, if you have no pain, you come down all the way down, even up to the ground, and stay here. And again, breathe out longer than breathing in. And in a home practice, you stay here between 5 to 10 breaths. It's a wonderful practice, wonderful relaxation called Yoga Mudra. You get up, slowly get up, one step at a time. Beautiful relaxation. And when you're relaxed, you feel a level of lightness in your body and mind. If you can do with me, let's see if you can do. It's called your Tadasana, lifting. You can put your hands on both sides. Push your hands down, your whole body goes high up and stays high up. You don't feel much weight. You feel a level of levitation. I'm talking, I'm breathing, I'm still in a state of Tadasana. You go to Gomukhasana, it's another one. When your hand gets relaxed, you can do your handstands, beautiful handstand. Bakasana, you can do Mayurasana, Mayurasana, Pongo Mayurasana. I've shown you my Mayurasana, Mayurasana. Mayurasana is a lotus pose, you do a Mayurasana. Pongo Mayurasana is do with one hand. Relax lower part of the body. And after proper relaxation, we will do the Asana and then do the Pranayama. Asana will do primarily Asana for your improving your health. So if you do it for the feet, you put your, keep your body straight. And the way to keep the body straight, put your hands on side. This is called Dandasana. Ankle is very important and toes are more important. If you can separate your toes, you get relaxation of your feet. Separate your toes, do with your breathing. Breathe out first, take a deep breath in, then breathe out. Breathe in, breathe out. Separation of the toes creates a relaxation of your foot. All the feet pain, plantar fasciitis, bunion, hammer toes, heel pain, all due to tightness of the plantar fascia. Ankle joint carries all the body weight. Relax your ankle joint. Breathe in, breathe out. Breathe in, breathe out. Breathe in, slowly rotate your hand. Remember, knee joint, hip joint, it just transmits your body weight. And when your posture is not perfect, when you don't have a straight spine, your posture, you get all the problems with your knee joint and hip joint. Largest number of joint replacement is your knee joint, then is the hip joint. But for your physical independence, you need relaxation of your ankle. You can do the relaxation of the lower part of the body or upper part. It's called your Paschimottanasana, seated forward bend. Take your hands and slowly drop it down wherever it goes. If it goes here, is good. If it touches your toes, is better. Keep your spine straight. And the best way to keep your spine straight is look front. And slowly you can drop your head down. When you get properly relaxed, you also can put your hands together, can clasp your hand, put it here, and slowly bring your head down. Head will come and touch your legs. Whenever you are here, remember, always stay in the pose. For yoga therapy, stay between 5 to 10 breaths. And practice at home like this. Practicing with me, then when you get up, slowly get up. And since you're relaxed, support your hands and slowly get up. Very important, a complete relaxation practice. You can use your hands to separate your toes. Bring it up, use your hand, put your finger in between the toes, and toes will be separated. Initially, it will be very tight. You won't be able to put in. The market is full of it. Yoga toes, yoga socks, yoga shoes. But the basic concept is separation of the toes. So put in here. Then you can see between knee and hip how easily it is relaxed. You bring your knee all the way high up. Breathe out first. Take a deep breath in. Slowly let the knee go down. It will go down on its own. You don't have to do anything. If it is here, let it be here. Close your eyes. Do the breathing out longer than breathing in. And slowly it will go down on its own. If you push it down, it will always come back like this. So here it is. Breathe in. Breathe out. Wonderful practice. Always balance it. So take the other foot here. Put your fingers through your toes. See how beautiful it is, go in and out. It is so relaxing that it really quiets down your mind. Manasthir doesn't bother you anymore. If you can do it, just sit down in a chair and just put it. Take your knees all the way high up. People ask me how long you do yoga. So yoga is a 24/7. Morning practice is good. After all the morning rituals, we do 1 hour of yoga therapy practice, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. So wonderful practice. And all of you should do it to use yoga therapy as a lifestyle medicine. Knee and hips are very important joint. In yoga tradition, knee is the site of fear and hip is the site of emotion. So if you can relax both of them, so if you can relax your knees, you control your fear. What is the fear of unknown? Is a stress. And hip is a site of emotion. When you control your emotion, you control emotion-related disorders, which are the neuropsychiatric disorders. Even hypertension. Hypertension is your emotion-related disorder. This is your Baddha Konasana. Put your feet together. Slowly bring it close to you. Clasp your hand, put it here, and slowly drop your both the knees down, and slowly both of them will come down. If you can move it a little bit, it is called Titli Asana. If you keep your eyes closed, do it within a short time, you'll see both the knees will come down and will touch the ground. So wonderful practice. See, for me even, I just started on top, I'm touching the ground now. Relaxation of the hip. relaxation of the emotions. These are 5 asanas for proper elimination, 5 or 6 asanas to increase your digestive fire. So let me show you one asana for proper elimination. And first, for all the relaxation in the body, you can look at it. This is called your, so if you can sit down properly, this is called your Malasana, or a squatting pose. You put your feet here, slowly and slowly you come down, and you can sit down like this. Look at here. My ankles are relaxed, knee are relaxed, hip is relaxed. When you put your hands, separate your fingers, your hand is relaxed. Extend your wrist will be relaxed. Put all the elbows inside. Slowly bring it close to you. Keep your spine straight. Close your eyes and breathe in and out. Malasana. By the time you do it, no lifestyle disorders will come to you. Proper elimination, you sit down here in the morning, first thing in the morning, drink a glass of water. When you drink a glass of water, remember it relaxes your pelvic muscles and the sphincters. It straightens up your anorectal junction, becomes straight. Remember, normally there is a kink so that we don't have any incontinence. Sitting down here straightens it up. And when you drink a glass of water, it starts called a gastrocolic reflex. Stretching up the stomach, contracts your colon. Then what you can do is called your Shankhasana or Udarkarshanasana. This is one of the asana for your easy elimination, which is in Sanskrit, in yogic term, called a Shankha Prakshalan. Shankha is your metaphor of the intestine. Prakshalan is a cleansing. Hands on both the knees. Take your right knee slowly in front of your left foot. Use your left hand to push your left knee towards the right side. Breathe out first. Take a deep breath in and slowly turn your body to the left side. Udar Karshanasana. Udar means your stomach. Karshan is the message. It massages your stomach wall, so you had a proper elimination, proper bowel movement. Proper elimination in the morning is a sign of health. Opposite side. Same way. Left knee in front of your right foot. Right knee goes towards your left side. Deep breath in. Slowly turn your body away from you. Shankhasana or Udarkarshanasana, another 4 asanas called Tjak Bhujangasana, Utthita Tadasana, Tjak Tadasana, Katichakrasana. I'll tell you the English name, all of them. A sign of health in yoga, which will create, we call it like antivirus software. So no disease will come to you. No endogenous disease will come to you. No lifestyle-related disorder will come to you. Able to get up without a support. If you can get up without a support, this is called sit-rise test. You do it, practice it daily. Comfortably, you sit down like a squatting pose, and you get up in a standing pose. When you get up, going against the grain of your habit is yoga. So I'm comfortable standing like this. See if I can stand with my feet together. Very comfortable. Then I feel like my ear, my shoulder, my hip, and my ankle in the same line, called a Tadasana. Also, you can check your balance. Nice way to check his balance is that you can cross your feet, So you can cross your feet. So you can sit down, crossing your feet, and getting up, crossing your feet. This is yoga. Putting your body in a shape of a pretzel is not yoga. This is quieting down your body and mind. To the opposite side, sit down, crossing your feet, getting up, crossing your feet. Wonderful practice. Three asanas for proper elimination. Utthita Tadasana, upward mountain pose. Put your feet together. Take your hand, clasp it. When you relax it, clasp it. You can turn it around, put it over your head. And then you breathe out first. Remember, all yoga practice, you breathe out first. Take a deep breath in. Breathe out. Slowly get up in your tippy toes and hand goes high up. Upward mountain pose. Then slowly come down. A friend of mine, he's a gastroenterologist. He has done this Shankha Prakshalan, proper elimination, as a preparatory to colonoscopy. He is shown with your barium meal study by X-ray that by doing these asanas, it helps proper movement of your intestine and proper elimination. One more time, breathe in first and slowly get up in the tippy toes and all the way high up. Next thing you do called Tjak. Tjak. Tadasana, oblique mountain pose. You can clasp your hand and high up, or you can hold your arm. Left hand, hold your arm. Right hand is holding it. If you put your hand, this is to balance your vata. Vata people are very mobile. So this is the way, control your vata. Breathe out first. Take a deep breath in and slowly turn on one side. And remember, you are breathing. Everybody asks me, when do you breathe? No, you totally effortless breathing. Breathing out longer than breathing in. And as if you're talking, you are singing. This is your normal posture. You'll be able to sleep. And this is your sabasana. Breathing out longer than breathing in. And slowly get up into the middle. You don't need a sabasana when you do yoga therapy, because every asana is a sabasana in yoga therapy. Breathe out first. Take a deep breath in. Opposite side. Do with your eyes closed, effortless breathing, wonderful practice. Keep doing it. I have all the Western medical explanation for all these asanas. It's called external and internal alignment. Very, very important. So the three asanas, Udarkarshanasana, or Shankhasana, Utthita Tadasana, Tjak Tadasana. Next to Kati Chakrasana. Separate your feet. Kati means west, chakra means rotate. You are rotating your west. Put your hands in front. Breathe out first. Take a deep breath in and slowly turn your body all the way to the back. Rotating your west. And same breathing cycle, you come back in the middle. That's how you extend your exhalation. Breathe in here and breathe out. So this is the number 4 asana for your Shankha Prakshalan, a proper elimination. which is one component of your health, and slowly come back again. This is such a powerful tool. This is called a moving meditation. You can do the eyes closed and follow your breath. Breathe out first, breathe in, and do it on your own breathing cycle. You also can do it different way, putting your hand in the back, like a left hand goes to the back, a right hand goes over your left shoulder. Breathe out first, take a deep breath in, and slowly rotate your body. In the exhalation phase, and in the same exhalation, you bring it in the middle. Chakrasana. Your right hand back in. Left hand goes over right shoulder. Breathe out first. Take a deep breath in. Slowly turn your body. So one more asana left for proper elimination. Laying down, which is called a Tjak Bhujangasana. Oblique cobra pose. I'll show it to you when you do laying down asanas. So the way we do it, we do sitting posture, standing, supine, and prone. Supine is your face up, prone is your face down. Balancing poses are very, very important, so you can create a balance. How to do it? Remember, balance comes from a hand, from my eyes. When you fall down, you always fall down in one hand. Take your hands up. See if you can close your eyes. And you can do a Paschimottanasana, or you can do a Baddha Hastasana. Take your right hand, hold your left arm, left hand, hold your right arm. Then see if you can stand on a non-dominant foot. I'm a right-handed, right-footed, so if I can stand on my left foot. 10 seconds, feels like almost 10 years. 20 seconds, very good. 40 seconds, you are there. Then you do one almost next to impossible task. Close your eyes if you can be there. If you can close your eyes and be in this posture, you have a literally control over your mind, and it is almost a therapy for your lifestyle-related disorders. Closing eyes and able to stay in one foot. I practice every single day. Still, I have a lot of problems. Must be, I'm just a human being. I'm mortal. Okay, again, do the opposite side now. Hold on the other side. And practice of the opposite foot. Longer and longer you stay, better and better your health going to be. Close your eyes if you can do it. Many a time with the closing your eyes, you can say mantra. Mantra is a vibration, quiets down your mind. I generally do a mantra on the standing posture like this, and it really quiets down your mind. Very, very important practice. So, as I said, all these people with lifestyle-related disorders, they are on a beta blocker. Beta blocker prevents a sudden rise in your heart rate, sudden rise in your blood pressure, and in medical knowledge today, a sudden rise in heart rate, sudden rise of blood pressure causes shearing effect on your plaque in coronary arteries or any arteries. It's called a plaque rupture. When the plaque rupture, then you may have a 30% blockage, which is not doing any hemodynamic problem. And a plaque rupture is like your volcano. Volcano is getting up because it's complete obstruction. See, a chronic blockage of an artery called stenosis, it creates your collateral pathway. That is not very harmful, but a sudden acute closure for the heart is called an acute coronary event. So, a effect of beta blocker in our body, what yoga gives us, is called baroreceptor sensitivity. We have two powerful baroreceptor. One is in the carotid sinus, the bifurcation of the carotid artery. You can do many a time with the massage of the carotid sinus, and cardiologists do it for supraventricular tachycardia. And we do it with a chin lock. When we put our chin down slowly, touch towards our chin, this is called a chin lock, and we do we take a breath hold and breath holding and inhalation, abhantarin kumbhak. It causes your a profound relaxation. The name is called Oje Pranayama. Other way to do it is called head below your heart. If you put a head below your heart, the pressure inside the brain goes high up, pressure inside the eyes goes high up, pressure inside the carotid artery goes high up, you feel miserable. But when you keep your head up for a little longer and longer and longer time, what happens? Baroreceptor sensitivity comes in. When the baroreceptor sensitivity comes in, the pressure inside the brain goes down, pressure inside the eyes goes down, pressure in the carotid artery goes down. You feel a profound level of relaxation. That is the effect of inversion poses. And that is the beginning of your headstand. That's why headstand is so relaxing that it's called a baroreceptor sensitivity. This is called Prasharita Uttanasana, like your spreading, head touching to the ground, and then you are so relaxed, you will be able to do a pranayama. I'll do Kapal Bhati pranayama. So I'm separating my feet, then you can put your hand and slowly try to put your head below your heart. So you can come until here, and if you can do a little bit more separation, for us, we can put our hands all the way out. You'll be able to see it. Then I can put my head on the ground. I'm in a profound level of relaxation, and this is baroreceptor sensitivity is acting like a beta blocker in my body. Put my hand here. I'm so relaxed. I can do even a Kapal Bhati pranayama. It gives a massage to your pelvic floor. Very good for your pelvic health. For men, it is very good for your prostate health. You can slowly get up. I don't miss a single day. Every morning I do this. I do almost I'm very relaxed. The way I do it, almost do 500 counts of Kapal Bhati pranayama. Let me show you a few asanas laying down, primarily for your proper elimination. And as I said, these are preparatory. You'll see by the time you can do this head down posture, we're going towards the inversion poses. Sarvanga-asana, Shirshasana, Viparit Karani. Okay. Let's lay down, do the asanas. We'll do the asanas for strong digestion, called igniting Jathar Agni. And then also we'll do asanas and few breathing technique, how to fall asleep. So when you are laying down, always remember one thing, that you try to always keep your chin below your forehead. So here I'm lying down. So if you can look at me, the way I'm laying down, Go down a little bit. I like to have my chin below your forehead. If I'm doing like this, it is sympathetic. This is parasympathetic. Parasympathetic. If I cannot do it, I can take a small pillow. I put it underneath. Remember, it is your body. You do like this. You feel a profound level of relaxation. Let's create a relaxation response first. It is called your abdominal breathing. You'll see a baby. Baby does all the breathing through your abdomen. It's called abdominal breathing. So if you're new to it, just give me a minute. Let me change the batteries. These batteries generally go out so quickly. Okay, I'm back. So we'll go the laying down poses to improve your digestive fire and how to go to sleep. 3 components of health: strong digestion, easy elimination, good night sleep. The first relaxation is your abdominal breathing. Like if you say baby, baby will do abdominal breathing. So put your head down. If you're new to the practice, put your hand on the belly button. You breathe out first. When you breathe in, abdominal wall will rise. Breathe out, abdominal wall will come down. Just go a little bit further here so you can see better. When you breathe in, breathe out. Separate your feet up to the width of the mat. Put your hands on the both sides. And do the abdominal breathing. Let me show you how to fall asleep. Called, yoga says, in a proper dreamless sleep. Sleep has the 2 components, REM, rapid eye movement, and non-REM. Rapid eye movement is still mind is still active. That's the time your dream takes place. Non-REM has 4 stages: stage 1, stage 2, stage 3, stage 4. You keep on doing the abdominal breathing. Let me tell you how to bring you back. Stage 1 and 2 is almost 50% of your sleep. Stage 3 and 4 is a deep sleep when all the repair of our body takes place. If you do daily practice of yoga, you're already in a stage 1 and stage 2 of sleep. So, when you first get into the bed, you lay down, and again, said if you can sit like this, you can put a little pillow underneath. This is a very nice way to put a little small pillow underneath. Then you sleep like a baby. What is that? It's called a Supta Baddha Konasana, laying down, closed angle pose. You'll see all the babies sleep like this. They put the feet here together, and slowly when you put there, and if you see slowly and slowly, both of your knees will come down. So hands on both sides, and you do the abdominal breathing. Generally, I say about 10 counts is good enough to bring sleep. This is also the yogic therapy for insomnia and sleep apnea. Then you practice first exhalation longer than inhalation. Generally, I do 5 counts of exhalation longer than inhalation. Then I do 5 counts of breath holding in a ratio of 1:4:2. Like 1, like a count of 4 in, count of 16 hold, count of 8 out, to 5 counts. So for demonstration, let me show at least one time so you can go ahead and practice it when you are sleeping tonight. This is almost guaranteed, you know, money back guarantee, the sleep will come. First, breathe out first, breathe in and breathe out completely effortlessly. I can do a complete effortless breathing. Let me do it count of 5 in and count of 10 out. Breathe out first. Do it about at least 5 to 10 times, you'll fall asleep. To the breath holding, say start with a very simple way, count of 4 in, count of 16 hold, count of 8 out. Let's do it twice so you can see how to do it. Breathe out first, count of 4 in. Count of 16 hold. Count of 8 out. Again, count of 4 in. Count of 16 hold. Count of 8 out. After that practice, I first start with the turning on the right side. What the turning of the right side does, when you turn on the right side, your left nostril opens up. So generally, yogis sleep with a hand like this. They bend their knees like a fetal position, put the hand, and so what the sleep does, it reduces your body core temperature and brings a profound relaxation, a lot of other physiological effects. So initially, when the body core temperature is high, you want to open your left nostril, which is a cooling breathing. Chandranari, which is also parasympathetic. So when you sleep like this initially, you get a balance. Remember the balance. Body core temperature is high, so it is bringing the cooling inside the body. So when you are sleeping better, after a while, what you do, you turn on the other side and sleep on your left side. Let me show you the other way so you can see what I'm talking about. And this is the way all the yogis sleep. And I've been sleeping it for a while, and I feel a profound level of relaxation. I will have my left side, bring it here, and generally we put a pillow. It's not that we put a hand. Put a pillow here, and sometimes put the hand here. Now what is happening? A right nostril is heating, Suranari. This is the way right nostril opens up. Remember, when your nostrils are not open, you turn on the side, opposite nostril will open up. Your temperature inside the body is more cooling now, and the heating is coming to balance it. Also, you have your main venous drainage called inferior vena cava, which comes to your heart, and it is totally uninterrupted, and there is no pressure on it. So the whole venous return is normal. You get a better preload. Heart is getting a preload. Relaxation also causes reduction in the afterload. Increase in the preload, reduction in the afterload. It is a profound effect on your ejection fraction. Your ejection fraction goes way high up. And that's the way you sleep. Very important. Then when you get up, remember, when you get up, you don't get up suddenly. You get up slowly, turn your body, and when you get up, you slowly stay on your side of your bed for a while, and then slowly get down. And for me, first I sit down in a squatting pose and drink a glass of water called Ushapan. So very relaxed now. Let me show you how to improve your digestive fire, Jathar Agni. There are 5 asanas to do the Jathar Agni, increase Jathar Agni. So you are laying down here. So all laying down poses to improve your Jathar Agni. The first one is your Paschimottanasana. So slowly raise your feet high up, not too much, 30 to 40 degrees. Then you get up into Naukasana. So get your body high up, and you will see you get a little bit of a fasciculation in Naukasana. But it will go down slowly and slowly. Both pose. Remember, all the digestive fire is here. Kapal Bhati Pranayama will show you. That is the most important pranayama. Pavan Muktasana, knee chest, with your knees. You can put your hands here. Slowly bring your knees up. Also chest up. Touch your nose to the knee. And you can slowly even get up in front of the knee. When you relax, you can turn both side to side. Powerful asana to ignite your Jathar Agni. Markadasana, monkey pose, or your different name called Jathar Parivartanasana, Merudanda Sanchalanasana. Look in your left hand and both the knees, both the feet together, both the knees goes down, all the way down to the ground. Stay here for a longer time, 5 to 10 breaths. You'll feel a profound level of relaxation. To the opposite side, look at the right side. Both the knees goes all the way to the back. I'm showing you the technique, but at home you stay a little longer and longer. Another way to do it, you can put your whole feet, both the feet high up. And if your hand here turn, take your both the feet will come down and touch your hand. It's a little advanced pose. Very good for your igniting Jathar Agni. Should be looking at your right side and slowly will come down and will touch your left hand. I'm sorry, I've got a little obstruction here. Next asana is your Setubandha asana, or a bridge pose. So you separate your feet and touch the back of your heel with the tip of your hand. This is your posture. Try to do it with the eyes closed, it's better. Slowly get your body high up. You can put your hand on the ground and body will slowly go high up on its own. If you're properly comfortable, you can balance it, put one leg high up, then drop it down, the other leg high up. Very nice asana. But you should always remember, you should keep your body high up longer and longer. These are all relaxing asanas. Huh? Very important asana to ignite your Jataragni, the digestive fire for proper digestion. Padmastikasana. Feet touching your head. Hold your right foot, bring it up, and slowly touch your right forehead. Or touch the tip of your nostril. Nose. When you do that relaxation, you can feel the breathing also becomes very comfortable. Take the other foot, bring it up, slowly touch it to your forehead, touch the tip of your nostril. Finally, you can do both the feet. You can put your both and touch it to your forehead. Very nice asanas. Huh? When you relax, you can easily do like a Sarvangasana. You can do a Padmasana Sarvangasana, lotus on a shoulder stand. You can do plow, halasana. So, nice way to do it is that the Sarvangasana, you can go all the way to the back, slowly get high up. You can do Padmasana Sarvangasana. You can put a right foot here. Left foot comes down. You can do the lotus pose on a shoulder stand. All in relaxation. Also, you can do all the way back high up. You can do your halasana. How? All the way to the back. But you're talking, breathing, and you stay longer and longer. When you get up, you get into one side, put your body in a fetal position, head, forehead, and a folded hand. Head is supporting. When you're feeling comfortable, straighten up your left foot and slowly get up and sit down in a comfortable grounding pose. A lot of sitting down poses are there, but one of the wonderful sitting down pose relaxation is your Vajrasana, Thunderbolt. You can sit down, take your both the feet, separate, and able to sit down. Very nice. Relaxing asana, Mandukasana. It ignites your Jataragni. Take both the hands, do the Adhi Mudra, baby fist. Put level of your belly button. Breathe out first. Take a deep breath in. Slowly breathe out. Suck your stomach in a little bit. Slowly come down. Listen to your body's signal. No pain, effortless breathing. All the way come down to the ground. Touch your head on the ground. And do your breathing. Breathing out longer than breathing in. Stay here for your regular practice. But for me to show you these asanas so that you can look at them for your future viewing and practice. So whole body relaxation takes place with your Gomukhasana. Gomukhasana, relaxation of the upper body, lower body, is called a cow face. So here you bend your left knee, take the right knee and gently put it on the top of the left knee. The Gomukhasana came, you're looking at this, it looks like a cow face. So relax, you can do it. Let me show it to you. There's a lot of asanas which are therapeutic, but these are therapeutic asanas. So practice it. And you will see how the imbalance is corrected here. Now, my right knee is in the top. My right hand goes high up. Left hand comes here. I stabilize my left hand, use my elbow, put it in the middle. Right hand comes down, it touches, it hooks, literally handshakes each other. Look at that. Whole upper part of the body is relaxed, lower part of the body is relaxed. It's a profound relaxation practice. Now you'll see a very interesting phenomena, which you'll see that when to the opposite side, one side is easier than the other side. Now my right knee is in the top of the, now opposite, my left knee is the top of the right knee. Left hand goes high up. Right hand goes here. Again, I stabilize my right hand in the middle. My left hand comes down, it touches, it hooks, literally it handshakes each other. And I'm comfortable and equal on both sides. If you're practicing with me, you will notice your one side was easier than the other side. Very, very important yogic practice. Whole relaxation of the upper and lower part of the body. This is a profound relaxation response and parasympathetic activation. ACE inhibitor. ACE inhibitor is called ACE is called angiotensinogen converting enzyme or angiotensin converting enzyme. Angiotensin converts into angiotensinogen, converts into angiotensin, which is a powerful vasoconstrictor, increases your peripheral resistance and causes the increase in the afterload for the heart. A profound relaxation practice, parasympathetic activation, and your relaxation response is like your vasodilator. It's a relaxation of the peripheral blood vessel, reduction of the peripheral resistance, reduction in the afterload. Increase in the preload, reduction in the afterload. It improves your ejection fraction. It's a function of the heart. For aspirin, aspirin acts like an anti-inflammatory, anti-thrombotic. When you practice a yogi lifestyle, you have a water metabolism. And I have shown you during my demonstration of the daily routine, dinacharya. It's already recorded, both in YouTube and in the Facebook. Take a look at it. Drink a glass of water when you get up. Drink a glass of water after a main meal. Drink a glass of water when you're thirsty. So you show a sign of proper hydration. Your lips and tongues are wet. Your urine is very clear. And proper your osmolality of the blood basically is an antithrombotic. Nitric oxide, which is secreted from the nasal mucosa and also throughout the whole body. Also cyclic GMP, your acetylcholine, parasympathetic activation. This almost acts all like your anti-inflammatory. Coronary artery disease is one big component is inflammation. C-reactive protein goes high up. We have also specific cardiac C-reactive protein goes high up. It also goes down. For statin is called HMG, hydroxymethyl glutarate coenzyme A, HMG coenzyme A reductase inhibitor. It inhibits production of cholesterol. Cholesterol is made in the liver. Body produces cholesterol for a reason. Primary reason cholesterol is produced to produce your steroid hormones. And one of the steroid hormones is your cortisol. The cortisol is your hormone for your stress. So when you are doing a practice of relaxation response and parasympathetic activation, cortisol level goes down. So body does not need to produce that much of cholesterol anymore. Also, cholesterol is used for your production of the bile salt. Bile salt is used for digestion of your fatty food. And when you're practicing yoga, you will see you develop intuitive eating. Your body knows what is good for your body. Body knows that you feel lightness in your body and mind. Body knows you have a proper hydration. Body knows that your belch is clear. Body knows that there is no smell in your elimination. There is no smell in the urine, your excreta, perspiration. Body is appropriate natural urges. Body will be taking less and less fatty food. So we know the whole practice of yoga is almost like the counteracting the effect of aspirin, statin, beta blocker, and ACE inhibitor. In India, I have seen all these medications put in a one pill. It's called a poly pill for all the cardiac patient. Pranayama, which is very important, and for the lifestyle-related disorder, you basically do 3 basic pranayama. See, we're doing all the pranayamas. What are pranayama doing? Breathing out longer than breathing in effortlessly. The first simple pranayama is called Bhastrika, bellows. Bellows you can practice all different ways. So let me show you a little bit of a practice, and you do more and more at home. So bellows is your, like you use for your, the blacksmith uses it, or you can use it for your fireplace. So like, you know, active inhalation, active exhalation. We do a jalneti every morning, so you will have some drainage from your nasal mucosa. It's entirely normal. You can do a lot of different ways. You can do it raising your hand, pulling in the front, on the side. You can do. Let me show you just few counts, and you can do it at home, but do it effortlessly. No, like that. From the front. The hand raised up very slowly in a count of 10. We do a count of called Ishwar, Ishwar, with a medium speed called a Soham, Soham, very rapid called a Vishnu, Vishnu. Generally we do a count of 20 slow, 20 medium, 20 fast. Then we do this one cycle, repeat the cycle. It's a very good practice for a lot of called a forced Bhastrika pranayama. Let's just do 10 of each just to show you one cycle, and you get more and more at home. And when you pull it down like your Adhi Mudra, thumb inside and close. Slow 10. Medium speed 10. Soham. Rapid 10. Vishnu, Vishnu. Do until you have any effort, effortless. For us, we've been doing it for so long, we can continue doing it for a long, long time. Absolutely have no effect in our body and mind. This is very good for your respiratory system, washes away all the carbon dioxide, bring the oxygen back. In fact, if you take a deep breath in and breathe out, increases your tidal volume, then it's also called a three-part yogic breathing called Dirghoshash. Dirgha means long, Swas is a breath. Lung has a three lobe, lower lobe, middle lobe, and upper lobe. All of them gets filled up. Very important for your lifestyle-related disorder. Kapal Bhati Pranayama is, this is a balloon here, diaphragm here, another balloon here. Kapal is the forehead, Bhati is the shining. That means it's a detoxifying pranayama. It removes all the carbon dioxide, all the toxin, brings more fresh oxygen, looks like you are glowing. You develop called tejas. Remember, the Bhastrika Pranayama is called Prano Pradhan Pranayama. It brings your prana, the life force. Kapalbhati Pranayama is called Agni Pradhan Pranayama. It ignites your Agni, Jathar Agni, the digestive fire. And alternate nostril breathing is called a Vayu Pradhan Pranayama. It quiets down your Vata, Vayu, very good for controlling your hypertension and neuropsychiatric disorders. Bring your awareness in your belly button, push it to the back, it will hit the diaphragm, hit the lung, air will come out. Nothing moves, only your belly button will move. So let's practice it. And we generally do it with about a mudras. This is called a Nano Mudra, quieting down your mind. It's called Vayu Mudra, index finger down, quiets down your Vata, controls your pain. This is called a Shunya Mudra. This improves your hearing. They call it Prithvi Mudra, so grounding, very good for diabetes and obesity. Called a Varun Mudra. It controls your bladder function, fluid in the body, skin function. Ring finger, little finger, thumb is called your Shakti Mudra or Prana Mudra, gives you strength. Called Apana Mudra, middle finger, ring finger, and thumb. Index finger comes down. This is called your Apana Vayu Mudra or Hridaya Mudra, very good for a heart. Let's just give a sample. Let's do about just simple 1 per second, 50 counts. Just do a very nice your Dhyana Mudra. Put your index finger down, close your eyes, and you do it, and I'll tell the benefit of this pranayama. Just do simple 50 counts, very slowly, 1 per second. You keep on doing, let me tell you the benefit. Massages your liver, massages your stomach, massages your spleen, massages your intestine, massages your colon. Female massages your uterus, massages your ovaries, massages your tubes. For men, massages your prostate gland, massages all the internal organs. It also massages your diaphragm, massages your lung, so all the air comes out from your lung. In between the lung, there is an organ called your heart. Massages your heart. Gently massages your heart. When your heart has a problem, when the heart stops, we do a CPR called cardiopulmonary resuscitation. Massaging your heart. This is massaging your heart from inside. 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 This is massaging your heart from This is called internal CPR. Very good for people with lifestyle-related disorders, especially cardiovascular disorder. Remember, lung and heart is the same organ in yoga. Improve your lung function, heart function gets better. We sit down, we continue until we have any effort. And generally, our daily practice is 25 minutes of asanas, 25 minutes of pranayama, and 10 minutes of meditation. So in a pranayama practice, what do? We bring the effortless ease. That means we are doing all the pranayama as if it is a normal breathing. When I can do it, I can do the Bhastrika pranayama between 3 to 5 minutes, Kapalbhati pranayama between 5 to 10 minutes, then alternate nostril breathing, Anulom Vilom pranayama again between 5 to 10 minutes. Then you incorporate a little bit of a Ujjayi pranayama, which is closing your larynx and trying to breathe in, activating the superior and laryngeal branch of the vagus nerve. Very good vagal activation. Bhramri pranayama, which already shown it to you. Then we do a lot of other pranayamas are there. Sitali pranayam, Sitkari pranayam, Plavuni pranayam, Murcha pranayam. We have all the locks. We have all there. And if you look at my all the recordings, I do it every single session. So in an alternate nostril breathing technique is use your left hand, do the Nano Mudra again or Nano Mudra, touch your index finger and thumb, put it over your left knee. Your right hand, close your right nostril with right thumb. You don't have to shut down everything, just close your right nostril. You breathe out through your left nostril first. Breathe in through your left nostril. Drop your ring finger, little finger, close your left nostril, breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. Left nostril is controlled by the right brain. Right brain is intuitive, right brain is female, right brain is cooling. Left nostril breathing is called Chandranadi, Ida, cooling, parasympathetic tone. Right nostril is controlled by the left brain. Which is analytical, which is heating, which is male. Right nostril breathing is sympathetic, called Suryanadi, sun energy, Pingala. It exercises both half of your brain. It brings a balance back. It also slowly transforms your mind and starts going inwards and inwards. So use a Vishnu Mudra, use your index finger and middle finger in between your third eyes. Close your eyes, bring the awareness in the third eye, and also for balance, use your left hand, hold on to your right earlobe. Many a time, if you have a problem with keeping that, you can put it on a support on a small stool, or you can just generally leave it here, and you do alternate nostril breathing. Slowly and slowly we do about your 5 to 10 minutes completely effortlessly. We do meditative alternate nostril breathing, which is alternate nostril breathing without closing your nostril. That is a meditation. And during meditation is basically we control our five senses. In yogic tradition, mind is the content of your five senses. We hear, we see, we smell, we taste, and we touch. Pancha indriyo, five senses. And when that gets properly processed, the mind, it becomes your buddhi, so intellect. That's your manomaya kosha to vijnanomaya kosha. When that gets processed again more, it becomes your wisdom, anandamaya kosha. You're pretty balanced in your wisdom. So in a meditation, what you do, you try to control your five senses, and generally called a focused meditation. Generally, you can breath-centered meditation. You can visualize your breath and do it. Or visual imagery, like you can sitting down in front of a water, looking at the blue water, or sitting in front of a flame of a candle, and with your eyes closed, put your mind in the candle, and that quiets down your five senses. So what happens in your mind, you're generating all the thought process. In a day-to-day, you generate 30, 40,000 thought process. But most of the thought process are either in the past or in the future, very little in the present, and they're also repeat thought process. So in a meditation, you enter in between the thought process. There is a space called gap, and slowly widen the gap. When you get the widen the gap more and more, you still have the thought process, but you don't have the chattering. You don't have the repeat thought process. In yogic tradition, it's called chitta vritti nirodha. Let's do a couple of Ujjayi Pranayama, which will be relaxed. Then I'll show you a technique of meditation. And these are, I'm showing you all the techniques, as a session and class, and then you practice at home. Remember, if all the people who has benefit from your yoga as a therapy, I have hundreds and hundreds of people in this town who got benefited. And the only answer is a daily practice, a dinacharya, daily routine. In Ujjayi Pranayama, you try to close your laryngeal sphincter, try to breathe in. And tighter you close without any tightness. That means you're relaxed away. You'll also see when I'm relaxed, my abdominal wall will go in like a abdominal, your abdominal lock. You do a chin lock with a Murcha Pranayama. These are all, you do maybe every day we'll do a different practices. Okay, let's do just one beautiful Ujjayi Pranayama so you can see, and then we'll show you how to do meditation before we finish. Hand again is a very powerful mudra. This is your Nano Mudra, Nano Mudra. Put it down. With the eyes closed, you get a proper relaxation. You breathe out first. Take a deep breath in. Completely breathe out. Ujjayi Pranayama with Uddiyani Bandh. Victorious breathing with your abdominal lock. Profound activation of parasympathetic tone. Profound activation of the vagal tone, which is really a therapy for lifestyle-related disorders. For a meditation, you need basically two components. First is a Merudanda Achal, like a spine should be straight, and Manasthir, mind should be quieting down. The way you quiet down your mind is a focus So let's do today will be a focused, meditative, alternate nostril breathing. Like touch your index finger and thumb, put it over your knees, close your eyes, and bring your focus to your nostrils. Without closing your nostril, visualize you're breathing out through your left nostril. Visualize you're breathing through your left nostril. Visualize you're breathing out through your right nostril. Visualize you're breathing in through right nostril. Visualize you're breathing out through the left nostril. Let's do a few of this visualizing alternate nostril breathing that will be followed by a silence. In a silence also you quiet down your five senses. We'll do just for a short moment, few minutes of silence, but at home you do longer and longer, and we finish with a Padma Mudra and your palming and cupping. Close your eyes, spine straight, do a alternate nostril breathing in meditative, followed by silence. Slowly bring both the hands in front of your heart. Touch your little finger and thumb. Separate your ring finger, middle finger, and index finger. This is called Padma Mudra, Lotus Mudra. Connects your body, mind, and spirit. Slowly bring the Lotus Mudra close to your heart. Heart is the site of your soul, and whole yoga practice is a spiritual practice. Spirituality is called Atma Vidya, studying your soul. Soul is a self-discipline, self-realization, self-discovery. Yoga gives us wellness to counteract our lifestyle-related disorders, physical wellness, mental wellness, spiritual wellness. Physical wellness gives us strength and stamina. Mental and spiritual wellness gives us healing. Slowly bring your hand in front of your heart chakra. Anahata chakra, site of your cardiovascular system, thymus gland. Put your hands together, bow your head down. This is yogic gesture, it's called Namaste. I honor the divinity within you. You are divine, and I am honoring the divinity. Finish again with the pumping and cupping. It's a very powerful yogic practice. Rub your hands, rub your hands, rub your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Put your hands over the eyes like a cup. Let the eyes take all the heat from your hand. Then massage your forehead, massage your eyes, massage your face, head and neck. When you come to the neck, generally you massage your carotid sinus. Carotid sinus is here, which is the activation of your baroreceptors. It helps your baroreceptor sensitivity and parasympathetic activation. Wonderful practice for your lifestyle related disorders, and please continue this practice, and always practice with a called effortless ease, and always practice with a asana called Sthiram Sukham Asana. Thank you for participating. We'll see you again on next Saturday, same time, 9:30 a.m. USA Eastern Time. I see a lot of comments, a lot of questions. I'll be glad to answer all of them one day at a time. And see you next Saturday.